The cyclosporiasis outbreak is now linked to 4 more states. That's according to the CDC. Massachusetts is not one of the states. Federal and state health officials are investigating the outbreak with iceberg lettuce from central Mexico, the suspected source. Taylor Farms voluntarily recalled its shredded lettuce shipped to 27 states, including Massachusetts.
Well, joining us now to talk about how to protect your kids, Dr. Scott Hadland from Mass General Brigham. Dr. Hadland, good to see you.
Good to see you too.
All right, so we can control what our kids eat at home, but we know in summer, kids are at friends' houses, they're at the pool, they're at the pond, they're at summer camp. If parents suspect their kids might have eaten something, what should they be looking for?
Yeah, I mean, first of all, just to level set, cyclospora is a parasite, and we get sick from it when we ingest the eggs, and the eggs are microscopic and they hang out in food, things like lettuce, which has been recalled. It can also be in fresh herbs. It can be in berries, which have a lot of surface area and tiny little crevices that those eggs can hang out in. So these are the sorts of exposures that families want to be thinking about. But what a lot of parents don't realize that I'm talking to is that there's a big delay between when you actually eat those eggs and when you develop symptoms. And so if your child is having symptoms today, on Friday, you actually need to look back about 1 to 2 weeks. And so you want to look back to, 1 Friday ago and then 2 Fridays ago and sort of ask what may have happened in that intervening window. Symptoms that you want to look for as a parent are really just a lot of watery diarrhea and cramping and bloating. And these symptoms can last a long time, at least a week for many kids, sometimes several weeks. And they'll kind of come and go, leaving parents feeling like, gosh, my child's been sick for ages.
Yeah, pretty awful. So is that kind of the telltale sign from just a regular stomach bug, the longevity, like the severity? Is that how you tell the difference?
That's definitely one of the features that really sets this apart. So if you think about, for example, norovirus or adenovirus, which are common viruses that cause diarrhea, those symptoms often blow through after like a day or 2 or 3. Cyclospora infections will really last for a long period of time. So that's one distinguishing feature. The other one that's really important to know about is actually cyclospora doesn't spread from person to person. So it doesn't spread from kid to kid. It actually has to be, spread by eating food. And so, if your child is, for example, at a 1-week camp and everybody gets sick at that summer camp together, that probably isn't cyclospora because it takes at least a week or 2 from the time that everybody's ingested the same thing to develop those symptoms. That's probably a regular old, stomach virus.
How dangerous is this for kids, or should parents know that it will just run its course? It may take a long time, but it will run its course.
Well, it depends on the child, right? So younger kids are going to be at much higher risk for dehydration. Certain kids that may have immunodeficiencies or may have cancer on chemotherapy, for example, may be at higher risk for more severe infection and getting dehydrated. And so if parents are worried about their child, even if their child is otherwise well, yes, some cases will take care of themselves and just sort of pass on their own. But if you're worried, go talk to your pediatrician or healthcare provider. They can do a test to check and see if your child has cyclospora in their stool. And then there is a treatment. There's actually an antibiotic called Bactrim that can treat this and improve symptoms.
Well, that's good to know. So, is your advice, should we be avoiding certain produce, or is it still kind of rare enough that, eating healthful foods is more important?
Yeah, it's tough to say. I think the number of infected or sort of affected food lines is still relatively small. I think if families want to be safe and take proper precautions, they should be washing all of their fruits and vegetables. If it's something that they can scrub, like an apple or a cucumber, then scrub it a little bit. If it's lettuce that comes in a whole head, peel off the outside. That's often where the eggs are located, and just use the inner part of the lettuce. Even if you have previously washed lettuce, wash it again. And after you've handled food, make sure you use hot soapy water to wash your hands, because actually hand sanitizer doesn't kill these eggs.
Oh, wow.
Good advice.
Okay. Thank you, Dr. Hadland.
Have a good weekend. Thank you.
You too.